We'll now go over the landmarks of the patient's lower extremity, or their leg. We'll begin with the patella, which is a small oval-shaped structure, also known as the patient's kneecap. This is going to be located right in the middle of the patellar ligament, and you should be able to palpate it and move it slightly from side to side. Directly inferior to that, we'll find the tibial tuberosity, which is a bump on the patient's tibia that is connected to that patellar ligament, and it's just inferior to that patella. This is a bony tuberance, the superior portion of the patient's tibia. If we move laterally and use the whole hand principle, meaning we'll take our whole hand and place our palm on the patient's lateral leg, we'll feel a bony protuberance very easily, located right about here on this patient. That is the fibular head, or the head of the fibula, which is the lateral bone of the lower extremity. As we move down the patient's leg, we're going to begin looking for what's called the malleoli. First, the medial malleolus, which is the malleolus, or the end of the patient's tibia. So we'll go down the medial side of the patient's leg until we find that big bony protuberance, that big ball located down there, which is actually where the tibia connects to the patient's ankle, and that is the medial malleolus, also known as the tibial malleolus. Conversely, on the lateral side is the patient's lateral malleolus, or fibular malleolus. Now this is where the patient's fibula goes down laterally and connects to the patient's ankle. You'll notice that the fibular malleolus is a bit more distal than the medial malleolus, or the tibial malleolus. And lastly, I'll have my patient flip around here a little bit. We're going to be looking for the patient's calcaneal, or Achilles tendon. Now this is the tendon that runs from the gastrocnemius, or your calf muscle, down to your calcaneus, which is the tip of your heel, the bone of your heel, I should say. And you'll be looking for that tendon in between the two structures.